Okay, here are my 7 audience members.
What's up? So thank you everybody for coming. My name is Kyra Ramos, and I'm going to talk to you a little bit about assessing a multicultural patient. Mexican Americans represent the fastest growing ethnic group in the United States. In the healthcare setting, it's likely that we will interact with individuals of Mexican descent, so it is essential to be familiar with the traditional beliefs and practices in this population in order to provide culturally sensitive care. The Geiger and Davidhizer model includes 6 cultural phenomena, which are communication, space, social organization, time, environmental control, and biological variations. And this may be used as a framework when assessing and planning care for the unique individual. As far as communication goes, Mexican people tend to be fairly soft-spoken, so when speaking to them, you want to kind of keep the volume down, because an elevated voice may be interpreted as anger. Staying calm during times of stress is considered a virtue, and silence may often be used as an opportunity to process information. Do not assume that a nod is necessarily a sign of agreement, as a gesture is often a show of respect towards the practitioner. Be sure not to use an individual's first name unless you are first given permission to do so. As far as space is concerned, personal distance is quite close at 1.5 to 4 feet. Close physical contact is valued, and it's common for women to greet each other with a kiss on the cheek or a cheek-to-cheek hug, even if they have first met. And this suggests that touch may be therapeutic when providing care. Social organization. The family is of utmost importance to Mexican people. The unconditional loyalty is expected from individual family members, and the needs of the family as a whole is highly emphasized. Individuals will most likely receive tremendous support from both their nuclear and extended families. It is not uncommon for decisions regarding an individual's health care to be made by the family. For these reasons, it's important to take extra time to address the needs of the family when planning care in order to achieve optimal outcomes, as adherence to health regimen is not likely if the whole family does not accept health care initiatives. With time, Mexicans are present time oriented, and it's within cultural norms to focus only on the here and now, which may present potential challenges when taking an accurate health history. An individual may not be inclined to disclose past health information because it's not considered to have any bearing on current health status. Adherence to preventative health measures may also be challenging, as a client may have difficulty linking current behaviors to potential future health complications. Environmental control. Roman Catholicism is the predominant religion among Mexican people, and as a result, it may be common for a Mexican client to exhibit an external locus of control, meaning that an outside force, in this case God, determines the status of one's health. There may be a perception that good health is the result of luck or reward, and illness may be interpreted as punishment from God for immoral or perverse behavior. Now, this external locus of control may present complications in adherence to health regimens, as many Mexican clients may not believe that lifestyle choices affect one's health status. The biological variations in Mexicans. Mexicans, like other Hispanic cultural groups, are at an increased risk for diabetes and heart disease. Although it may be challenging considering other previously discussed facets of traditional Mexican culture, considerable effort should be made in educating clients regarding preventative health care for such diseases. There are 2 specific genes that have been frequently observed in individuals of Mexican descent that affect drug metabolism. The CYP3A4 gene results in slower metabolism and higher blood levels of the drugs nifedipine, cyclosporin, midazolam, and sildenafil. So patients may respond to a lower dosage. The CYP2D6 gene is linked to faster metabolism of many cardiovascular drugs, as well as many psychotropic drugs. So larger doses of these drugs may be required to reach therapeutic levels. Thank you for taking a minute to listen to me, and have a great day and a nice weekend, everybody.